Good afternoon. Welcome to Bariatric Friday, Delaware's only bariatric channel. We are advocates for patients, people who deal with morbid obesity, and we are here almost every Friday to help people who are struggling with obesity and morbid obesity. My name is Kemal Erkan. I'm here with Dr. Isaias Irgau. Dr. Irgau, how are you doing?
I'm doing great, Kemal. It's always great to be back on Bariatric Friday.
It is always fun to have the discussion with you here. So we are going to have another topic today, a little bit different than our normal topics. Mm-hmm. Here's how I like to start. So this is not a medicine that I'm going to talk about. It's not a pill that you are taking. It's not a drug that you are not taking. You are taking. It's not an injection. But here are the benefits of some of the things that this topic that we have today. Like it's going to lower your blood pressure, better make your immune system better, lower your heart disease risk, improve your self-esteem, decrease depression, increase libido. It gives you immediate pain relief, and then it makes you sleep better. And this is not some magic pill that you are taking, but this is sex. So when we have sex, these are the benefits of having sex. And these, anyone who actually just Googles this, they will find the same benefits right in front of them. Just make sure that you are not on some bad side that you shouldn't be on. So it should be a medical side. So these are just like the summary of some benefits, which requires several medications to get to this point. Now, even for healthier people, people who are not dealing with morbid obesity, but when it's about morbid obesity, now the challenge becomes even bigger because the struggle is anyone's regular struggle times 5 or 10 or 15. Now, these individuals who are not able to have regular, perhaps sex life, therefore, the regular benefits that everyone is able to get, they are not able to get. So I'm going to have Dr. Irgau to explain from the clinical point what we are discussing, and then I'll have some questions after that.
Of course. That was a great introduction, by the way. Kemal, you're absolutely right. A healthy, good sexual life actually makes up for many of the challenges in life. There is no question about that. Obviously, we're talking about sexual health in the context of the main problem that you and I deal with, and that is obesity, right? And we know from many studies, from our intuitive understanding, that obesity is associated with a fairly poor quality of life in many aspects, right? And one of those aspects is obviously sexual health as well. Mm-hmm. Although it's a topic that we don't approach and talk about very often, it is clearly there, right? Many of our patients who reach out for help with morbid obesity, seeking bariatric surgery, which currently is the most effective treatment we have for morbid obesity, don't open up on this side of their life, right? But a lot of research actually has been undertaken that has really delved into this, and it has shown that many patients who are actually seeking bariatric surgery because they're struggling with morbid obesity actually have struggled with sexual dysfunction at rates that are much higher from the general population, right? And why is that? Well, there are a number of factors, obviously, right? One is the fact that obesity itself, the addition of excess fat inside the body, is not just related to it, to the person having a higher weight when they are, on the scale. It does actually have impact on the health of the person, on the metabolism of the person, right? So from a hormone point of view, hormones are very important in our sexual health. From a hormone point of view, there are actually changes, there are physiological changes that are related to obesity, okay? In men, for instance, obesity results in lowered testosterone, right? Testosterone is the main male sex hormone. And that's actually what gives us a deep voice. That's the one that increases the bulk of muscles, that is related also to sexual desire and drive, right? And obesity, sadly, is related with decreased testosterone. And in women, there are hormonal changes also that occur with obesity, not as pronounced as it is in men, but clearly there are some, right? There are actually some hormonal conditions like PCOS or polycystic ovary disease that are related to hormonal changes that are much more common when obesity occurs. So on the one hand, you have obesity directly affecting our physiology, our hormonal balance. That is going to lead to sexual dysfunction. And then, of course, there are the other issues. Remember, we talk about obesity having an impact on other aspects of our health, whether it's cardiovascular health, whether it's diabetes, right? So if you have obesity and you have cardiovascular problems like high blood pressure, or if you have diabetes, these conditions themselves also affect health. For instance, men who have type 2 diabetes are more likely to have erectile dysfunction, right? And then, of course, we use medications to treat all these ailments, and those medications themselves also will have a detrimental effect on sexual health. And with all this, I haven't even touched the psychosocial aspects of obesity and their relationship to sexual health, right? So poor self-esteem, the presence of depression, this will have very, very strong negative effect on sexual health. So obesity, coming from many, many aspects, actually does have a very negative impact on sexual health. And that is part of the reason also why obesity is related to a poor quality of life.
So the benefit of having sex versus our patients who are going through the surgery right now, surgery process, or maybe even after the surgery, like it's going to take certain time to lose weight and get better and all those things. But do patients bring this up to you when they have in the consultation or any of the follow-up visits?
Indirectly, Kemal. It doesn't come up directly, right? But indirectly, patients talk about having poor self-image. Or very often, many of our patients will tell me that they haven't had a partner for a very long period of time, right? And that in itself reflects this, right? And also, this has been shown even in studies, Kemal, and I do remember us mentioning it in our previous session that some studies have shown that women with a higher body mass index are more likely to report that they haven't had any sexual partner for the previous 12 months when compared to women of normal weight, right? So we do see that. So patients may not bring it up openly, but we can get it from other, information. For instance, one of the most common questions we ask our patients to try to figure out whether they have sleep apnea is if they snore, right? Very often they will say, well, I do not know. I don't have a partner right now, right? So lack of sexual intimacy, which is related to, to the dysfunction itself, also is reflected in the relationship the patients will have, right? Or lack of relationship, obviously.
Well, that makes a lot of sense, right? So now we are going to come back to some of these, but what about the puberty? So there are some studies suggesting that this is actually delaying the puberty. Is that the case for the teenagers?
Absolutely, because obviously part of the developmental changes that occur at puberty are closely related to sexual maturity as well, right? So if there is obesity at that stage and there is lack of those, for instance, in young men, as they are maturing, if there is decreased testosterone levels because of obesity, there will be a decreased development of sexual organs, there will be decreased development of their voice, and there will be decreased development in their sex drive as well, right? Not to mention, obviously, other issues which have to do with self-image, young men who have large breasts, right, called gynecomastia, for instance, are less likely to be confident about themselves and seek partnership or be much more active, when it comes to getting partners or thinking about their sex life, right? Similarly, in women, obesity is associated with polycystic ovary disease, which is an imbalance in sex hormones as well, where women have an inability really to either have a regular menstruation or ovulate regularly, right? One of the key hallmarks of polycystic ovary disease is the presence of immature follicles, which are eggs that have failed to mature that populate the area around the ovaries, essentially, Kemal. So definitely obesity occurring at puberty will interfere with the normal development of the young men and women.
So now, just like any other disease, what I see, I kind of call this like, I think these illnesses are kind of like races, or they are sexes. So this one is one of those. It's kind of like sexes in a way that it has different impact on women and different impact on men. Now, in terms of you mentioned the erectile dysfunction, and any time this BMI over 28, the risk of developing erectile ED, let's go, by 90%, the chance of increasing that, which is, well, for many men, this is a huge problem. And, this is, again, like we see patients, like I see it in the chart, when patients are talking about it, because I see doctors are providers, other healthcare providers that are addressing these issues, but there's always that little, shyness. Well, there shouldn't be any. This is a health issue, which, again, the reason I started with the benefit of sexual activities is because when you are, it's one thing that you don't want to have those benefits, but the other thing is that you cannot have those benefits. So then the decision is not up to the person at that point. And this is why we are kind of treating the morbid obesity perhaps aggressively, so that, or most effectively, that people can actually make that decision. And if they don't want to benefit from those and they don't want to have sex, that's fine. But at least they should be able to make that decision on their own, right? So the decision shouldn't be made by them. And there's certain studies suggest that it has impact on the sperm count, that decreasing the sperm count. And those are all different problems. Now, we discussed in our earlier sessions, I remember, menopause and the impact on menopause. Can we talk about that a little bit?
We will. Kemal, before I talk to menopause, though, I do want to really underline what you just said about the higher the BMI, the more likely that there is sexual dysfunction, particularly in men, right? You mentioned erectile dysfunction, but also you mentioned, sperm count, right? These are real, right? The higher the waist circumference, the higher the body mass index, the lower the testosterone, the higher the levels of erectile dysfunction. I mean, there is no more clear correlation than sexual dysfunction and obesity, particularly in men. And of course, erectile dysfunction, as you said, is an extremely distressing condition that very often it is suffered in silence by many men. But as you said, it is a medical condition. In fact, more importantly, Kemal, it may be the first indication that there are medical problems going on, like, for instance, high blood sugar and diabetes. And this is more likely to happen in men who are obese. And with obesity rates going up so much in our society, these problems are going to be seen much more commonly. So an awareness on the part of the patients that this is something that is a reflection of a medical condition, and of course, more probing by the medical providers to look into this and help patients is very, very important.
Absolutely.
Yeah, and you've raised the issue of menopause, right? Menopause is that time of the life of women where there is a decrease in certain hormones, and that leads to a number of changes, right? And from our point of view, the changes are actually interesting. When I say from our point of view, I'm talking about us being interested in obesity or treatment of obesity, because menopause not only does affect negatively sexual function by decreasing desire, by decreasing lubrication of the vaginal canal, or elasticity of the muscles around the vagina, but also it is associated with increase in weight as well, right? And then increase in weight by itself will also lead to more sexual dysfunction. So the changes that occur with menopause, particularly in women who are struggling with weight, are very important from that point of view. Many women will find out that as they are approaching menopause, despite the fact that they have not changed very much their lifestyle, whether what they're eating and the level of activity, suddenly they will find that the clothing that they were able to wear, just months before, now they are too tight for them, right? And they see a rise in the scale as well. So those, awareness of that is very important. From our point of view, obviously, in menopause, we also see a much more difficult time for women to try to lose weight, whereas prior to menopause, maybe a little bit of effort, they were able to lose some weight. With menopause, this becomes even harder. And then, as I said, in menopause, there is this interrelationship, almost as the lines of obesity and lines of menopause are crossing at a time that conspire to really create more sexual dysfunction.
So the studies, that's actually, I'm just going over some of the studies with menopause, especially taking the onset date of menopause earlier. I think that has a huge impact on women. So we are going to discuss the menopause in our other session with one of our state officials and one of our primary cares. I believe that's going to be on February 10th or the 17th.
Mm-hmm.
So because menopause by itself is a huge issue for
Mm-hmm.
people who are going through that, but when we are complicating that by adding the morbid obesity, that's why things become more complicated, more problematic. So, because the challenge, the obstacle is already there, and even without those issues, you have that obstacle and then you have those challenges. So when you are not able to go through these challenges with the equal opportunity, I would say, then that's where the challenge starts.
Right, and also, from a woman who is struggling with, obesity, right? From her point of view, right? Obesity itself, even prior to menopause, as I said, does have an impact on sexual health, right? Even if we were to leave the hormonal changes aside, Kemal, the lack of self-esteem, right? And then the fact that there is an increased level of depression, all those things themselves are actually going to be affecting, sexual health, right? So, if even in a stable relationship, if there is some perception from one of the partners that their body image may not be as appealing or as attractive as it used to be, they are even, unconsciously more likely to shy away from times of intimacy that requires exposure of their body, right? And so lack of, sexual life that precedes menopause is going to be even more complicated after menopause, because then there will be even more physiological changes, lack of desire, and lack of drive that will be even increasing that, right? So not only the person's, sexual life is being affected, but then the sense of feeling guilty, but also the complications that it creates in the relationship itself also are going to make that person more unhappy. The perception that their partner is unhappy because of, because of a non-existent sexual life or poor sexual life is going to make them even more miserable, essentially. So all that will affect definitely the quality of life.
Absolutely. I think maybe perhaps like one of the issue is the biological complication that morbid obesity brings to the table. But I think the other problem is even practically it becomes, even if you don't have the ED problem, you don't have the desire problem, you don't have the self-esteem problem, physically you are not able to, because some of our patients are, like we are talking about like BMI 52, 57, 62, like physical contact is almost so difficult, and that they may not be able to bring these issues up because it is, in a way, with just like the society we live in, every time we say sex, we have to spell it. So because the kids are going to hear it. Well, no, this is part of life, and they're not able to talk about it. So this is again another stigma problem where we are not talking about watching porn together. We are talking about having proper or regular sexual life for people, and this should not be part of the stigma. Patients shouldn't be embarrassed about these. They should be able to talk about with their healthcare providers. But I know I can still see the challenge, and saying these things is easier, but when it becomes personal, I think we become a little bit shyer or shy away from these issues, and not even with our healthcare providers, we are not discussing these issues directly.
Right. But I mean, you were talking about, the actual endurance, right? The performance itself, right? It requires a certain level of physical fitness. And with morbid obesity, people have a hard time walking up the stairs, walking a few steps just because the weight is too much. In which case, even the act itself becomes very hard, Kemal, because it just is not there. The endurance is not there. The weight itself is an impediment physically, as you say, to do that. So very often it will be ignored. Very often it will be avoided, which means that there will be long periods of abstinence, which obviously are detrimental for the sexual life of the person.
Absolutely. Now, in terms of the patients who bring up these issues, and I know more of our patients are female patients, is the shyness comes from men or women in terms of bringing this issue up?
Oh, there's no question. I think women are much more open to talk to their doctors about these issues, and that's really applies to many areas as well, in a way that also, in my view, is one of the reasons that, in general, women are more likely to seek help with a health condition as opposed to men in general. But definitely in research, you would see time and time again that there is much more openness and responsiveness from women than there is from men. And this is likely to be amplified when you talk about sexual dysfunction.
So, when we go through the case conferences on the ACO side, I see in some cases patients who are older looking for medication, and I see like 74-year-old who's on Viagra, who's 76-year-old who's calling for a refill for ED medicine. And that's when you kind of realize, because yes, we are speaking about this and try to remove ourselves from the actual topic itself, so then it becomes more like a talking point. But when I see that, I'm like, oh, the 76-year-old is still looking for this. So I say this personally, I do say this. So, and then as soon as I make that comment, I feel like, okay, I'm judging the person who's older, thinking that they don't have sex anymore, right? So, and if I'm doing this, I know that other people are probably having more difficult issues bringing this up to their providers, or sometimes even talking to the office staff, like, because when we go, when you get your physical, she asks like, "Oh, are you sexually active?" I'm like, "None of your business." That's what.
Yeah.
But you don't want to talk to perhaps everyone about it because it becomes like a private. But then it's not, because if it's a problem, then you should be able to talk about it.
Absolutely, absolutely. As I said, I mean, ED, erectile dysfunction, is a classic example of that, Kemal. I mean, first of all, as I said, there are treatable reasons why men have erectile dysfunction, and we are talking about one of them, for instance, which is obesity, right? The fact that there is excess weight is associated with that condition, right? But more importantly, erectile dysfunction could be the first symptom of an underlying medical condition. If a patient is developing type 2 diabetes, for instance, or if they are developing peripheral vascular disease, that may be the first manifestation of it. So when it comes to talking to your doctors, there should not be really any shyness, because obviously and delving into what's going on in the person's life in many aspects of it will give the physician an insight into what the problems might be, and therefore provide solutions as well. So I think it is good and it's important that our society is becoming more and more open in terms of what people bring to their providers, to their physicians, because that only can lead to improvement and solutions, if the problems are exposed. When it comes to, people being sexually active, even, at a later stage than it used to be, this is really a reflection on how much we have improved in terms of our overall health, right? Medicine has improved many folds over the years. Life expectancy is going higher. But this is in serious danger for the first time, Kemal, because obesity is rising, right? And with the rise of obesity, we are seeing a decreased life expectancy. We are seeing people struggling more and more with illnesses that are treatable if obesity can be treated, right? So, it's like a paradox. On the one hand, we are seeing really an expansion of enjoyment of life into later and later years. On the other hand, we're seeing these rising levels of obesity that are putting these enjoyments in danger, that are putting all these achievements of our society in danger, because people are becoming sicker earlier in life because of obesity. That's why treating obesity is such an important part of healthcare everywhere in our society currently.
So again, for me, the interesting thing is, as we said in the opening, so if I were to promote a drug right now, some medicine pill, and say, how we put all the side effects of the medicine, once you read it, they go, okay, so if I'm going to have all these side effects, I'm not going to have this. But if you put the benefits in, and the benefits would be from lowering your blood pressure to lowering your heart disease risk, lowering your depression, increasing your immune system, increasing libido, pain relief, and then better sleep, then this is like a magical drug. And then you don't have to buy it. You can actually get it in your own home, in your own privacy. But this is why we want to help people with morbid obesity, so then they would be able to make those decisions on their own, so this decision is not made for them. And then hopefully we can reach out and educate more people about bariatric surgery, which is the most effective treatment method for morbid obesity. And then we'll have more discussions in the future regarding different topics. Dr. Erkan, I don't know if there is anything else that you would like to add.
No, I think you've said it's Kemal. Obviously, we're talking about extreme levels of obesity, right? We're talking about obesity where the body mass index is greater than 35 kilograms per meter square. We're talking about obesity where the person's weight is at least 50, 60, 70 pounds higher than where they should be, right? And for this level of obesity that now affects every aspect of one's life, whether it's their health in terms of blood pressure, diabetes, sleep apnea, or their quality of life, including sexual health, We do have treatment nowadays that's called bariatric surgery. It's a very effective method that has achieved higher levels of safety, particularly in mature and experienced programs like ours. That's why we're bringing this to the forefront, because as you and I have always said, there is a much bigger need compared to what we are able to provide right now, because either people don't know or people have the wrong information about the importance of bariatric surgery. That's why this Bariatric Friday sessions are excellent, and I'm very proud to be part of it.
Absolutely. Well, thank you for joining us, Dr. Erkan. And for those who are following us, so we'll be off for next 2 weeks, but we'll be back on February 3rd with new topics. Our agenda for February is to report back to you guys from our patients who were part of the initial cycle. And then I'll be reporting back to you on those patients. Well, thank you for joining us, and thank you for watching us. We'll be back in 2 weeks.